Hi everyone, it's me, Birdie. Um, so for my final project, I went on to do the case study on George K, which is an individual who is both LGBTQ and an older adult. And since in the future that is sort of my area of focus, and I've really tried to tailor my studies within that intersection of the population. Um, After reading George's case study, um, I felt that I could draw on the literature that I did from the literature review that involved the subject matter of LGBTQ older adults, resiliency, but even exploring um, new literature through some of the presenting problems that were in his case. So for George K, he is an older adult who identifies as LGBTQ. He is 76 years old. He is also a cisgender white man who is HIV positive. Um, and is seeking help after a um, bad rapport or just a difficult situation with their previous healthcare provider, who essentially, from what I understood, gave them an ultimatum to go to alcohol and drugs and other drug disorder counseling um, in return for his continued HIV treatment and medical care management. The reason the attending primary physician did that is because George also has a substance use disorder or something, or substance use misuse or disorder, particularly stimulant use disorder, which involves methamphetamines, and as you read the case, there's also the introduction of opioids as well. um, and so even though George does show a pattern of trying to get help for these. They have gone through therapy and things of that nature. The ending of that physician relationship really put his life at risk. Uh, and then it made it more difficult for him to maneuver uh, the the substance use disorder. So, in looking at their case, I really drew on literature that um, focused on LGBTQ older adults, um, particularly social isolation, because that is one of the other things that was in his case, that he really didn't have support systems, um, and the only support system that he had was his playmate, someone who he would be sexually involved with, but also was also a means to have access to opioids and methamphetamines. So the way that I went about it was uh, drawing on getting them connected to LGBTQ older adult agencies, particularly within Michigan, Sage Metro Detroit, which has a friendly caller program, which is a caller buddy system, which could sort of really help expand his reach to get connected with other LGBTQ older adults or just LGBTQ folks in general, because the program is not, it's also intergenerational. Uh, but it was started particularly for older adults. Some of the literature that I drew on were around really taking a look at trauma informed approaches, and also culturally responsive literature, uh, like that of Fabre, Um, there was a piece through the Research Institute at the University of Buffalo about trauma informed approaches, uh, to really make sure that if there are agencies that we are going to refer them to, uh, or have them interact with, that they have that basis, that they've been vetted for as being LGBTQ affirming, um, and allowing him to also be part of that intervention plan, to get him the help that he visions for himself and really help uh, moderate his substance use misuse disorder. Um, that's a little bit of my case. Thank you so much for listening, and I hope this paints a little bit of a picture.